My name's Mallory. I'm a Texas State Nurse Practitioner student, and today I'll be doing a focal exam on you. Before I walked in, we already had a discussion, and I learned that I have a 48-year-old male patient presenting today with acute onset of sore throat over the past 24 hours. He reports a fever of 100 degrees with some chills. He does report some left-sided neck pain, and he took Tylenol 500 milligrams times 2 just once orally. He reports no shortness of breath, no cough or congestion, or any recent illnesses. He does report having some left ear pain with pain a 5 out of 10 on the numeric scale. The patient did not receive a flu vaccine this year. He did mention that he's up to date on his tetanus and MMR booster shots. He denies any smoking, alcohol, or illicit drug use. He reports no comorbidities. His mother is alive. She's 82 years old with no significant health history, and his father is deceased at age 80 from colon cancer. He reports no other medications except just the Tylenol over-the-counter meds. He has no drug, food, or environmental allergies. He reports feeling safe at home at work, and his last physical was in August. So today we're going to start conducting our exam. So I'm going to start inspecting your ears here, feeling around, no tenderness when I'm touching here at all, no deformities noted, no lumps or anything around the ears, no drainage noted as well. I'm going to look in your ears now, sir. I'm going to pull up and back. So this ear looks good. We can see the tympanic membrane is pearly gray. We can see the cone of light reflex. We can see the handle and malleus. Left ear, you do report having some pain, is that correct, sir?
Yes, ma'am.
So this ear does appear to look infected, sir. You have a bulging tympanic membrane. It's red in there, so that's probably why you're having pain, sir. You also do have a little bit of fluid in there as well. Now I'm going to be looking at your neck and inspecting your neck. Upon a visualization, it does look like your neck and the lymph nodes is inflamed. You did report having some pain on the left side, is that correct?
Mm-hmm.
Okay. Now I'm going to be palpating, okay? So, do you have pain when I'm touching around here?
Mm-hmm.
Okay, so we have your occipital lymph nodes, we have your post-auricular, your pre-auricular lymph nodes, we have your submandibular lymph nodes, we have your submental, we have your supracervical lymph nodes, your post-cervical lymph nodes, your deep cervical lymph nodes, and your supraclavicular lymph nodes. Now, upon palpation, your left supracervical lymph node is inflamed right here, just so you're aware of that. Your thyroid is midline, and if you'll swallow for me. Great. Trachea appears midline, and that all looks normal. All right. Now I'm going to go back to your nose. Any nasal congestion?
No, not much.
Okay, inspecting your nose. There's no drainage there at all. There's no polyps, no blood or anything like that. Can you breathe in? Breathe in again. Can you breathe in okay?
Mm-hmm.
Okay, so patent nasal airway. Now we're going to look inside your mouth. If you can open up your mouth for me. Okay. Teeth appear in good order. No dentures noted. If you'll move your... Good. So tonsils appear +2. They're red and swollen. Uvula is also swollen as well. Stick your tongue out for me. All the way, good. Now you can close your mouth. Now I'm palpating your TMJ. You're gonna stick your tongue in there. Okay, good. And then if you'll open and close your mouth. Okay, good. So your back of your throat is really swollen and red. So at the very end, we're going to swab you possibly for strep is what I'm thinking. Okay, sir? If you'll get up now and turn around and face that way, but still sit on the stool for me. I'm inspecting your back now while you're breathing. You have no retractions or heaves. Your breathing looks symmetrical. AP and transverse diameter is symmetrical. You're not using any accessory muscles while you breathe. You don't appear like you're having any shortness of breath. Your skin looks good, intact, with no bumps. I'm going to squeeze the back of your back here. If you'll go ahead and take a deep breath and let it out. Good. Equal chest expansion in the back. Now I'm going to percuss over your lung fields here. While percussing, I'm hearing resonant lung sounds, which is what I should be hearing. And now I'm going to be listening. Take a deep breath. Breath sounds sound normal. Bronchovesicular sounds, no wheezes, rhonchi, or rales heard. Great. And if you'll come back and look at me, if you'll turn around again, sir. Great. Now I'm going to be looking anteriorly at your chest. Skin appears normal yellow to tan. Skin turgor is good. No bumps or any lumps. Now I'll be listening again. Take a deep breath. Another deep breath. Another deep breath. Okay. And again, bronchovesicular sounds heard. Chest is clear. No rhonchi, wheezes, or rales. Okay. We're going to end our exam, sir, on the table. If we can move over here, please. And go ahead, I provided a pillow here for you to lie down. All right, now I'm inspecting your pericardium. That all looks intact. No pulsations noted. Now I'm going to be palpating. No pulsations noted. Any chest pain, sir?
No.
Okay, now I'm going to listen to your heart sounds. I got your sternal notch here and your angle of Louis, which is connected to the second intercostal space. And then your aortic area is the second intercostal space, right sternal border. And then we move to the pulmonic area, which is the second intercostal space, left sternal border. Third intercostal space is Erb's point. Fourth intercostal space, left midclavicular line, tricuspid. And your mitral is fifth intercostal space, left midclavicular line, which is the point of maximum impulse. Heart rate appears normal, regular rate and rhythm. Also noted, S2 is greater than S1. S2 is greater, heard in the aortic pulmonic areas, and S1 is heard best in the mitral area. I'm going to listen one more time with my bell. I have the aortic area. I have the pulmonic area. I have Erb's point, tricuspid, and mitral area. And then I'm going to finish my exam by touching your carotid. Carotid appears normal, and then I'm going to listen with the bell of my stethoscope. And no bruits noted. All right, sir, so that ends our exam. If you'll sit up for me. Thank you so much for allowing me to do the exam. We're going to run a strep test, so my MA is going to come in and swab your throat. Also, we'll be sending you out antibiotics for at least that ear infection, and we'll get back to you to see if you have strep within 10 minutes.